Senator Capito.
Thank you, Madam Chair, and thank you for our witnesses today, both of Dr. Walensky and Dr. Shuchat, and I wish you the best in your, we won't call it retirement, in your repurposing, how about that, wherever you may land. Let me ask specifically, Senator Shaheen and Senator Manchin mentioned, obviously, the overdose rates in the state of West Virginia, so I won't go back through that, but I am concerned. Dr. Walensky, I know you have a focus on ending the HIV epidemic. I know this is in your academic career as well. You mentioned it in the president's budget. West Virginia received a grant in the Integrated Viral Health, or Hepatitis, surveillance targeted funds to help us address certain areas, hotspots, I guess you would call them. But we are not an ending HIV epidemic focused jurisdiction, nor any of our counties. And in your testimony, you state that increased funding in the budget is for 4 key strategies in the focus areas, but not to increase the amount of focus areas. So my question is, I think we need to be a focus area because we have some of the highest incidents. And how do you expand that footprint, or how can you help me with that?
Thank you, Senator. As I think you noted, my 20-year career prior to January 20th was in doing exactly that, and I was really encouraged by ending the mission to end the HIV epidemic really through diagnosis, prevention, treatment, and response. When the initial tranche of HIV and the HIV epidemic money went out, it was to areas with the highest numbers, with truly a multi-year plan to expand to other areas that we needed to really curb things in the areas with the highest numbers, take some of the lessons that we learned and expand to some of the other areas. And so I have a vision and hope that we'll be able to do that in the years ahead and to continue that expansion.
Thank you. So expansion into areas such as ours, I think that would be welcome. I would make note that in the initial disbursement of the vaccine, our state of West Virginia did an incredible job working with our public health infrastructure. But I think one of the lessons that we learned, and that I hope this becomes part of a manual to address future issues, is public health infrastructure can't do this by themselves. Not to what we saw at the breadth of what we saw. So what happened? We had volunteers, we had county city governments, we had our National Guard. And so I would encourage you, while I think increasing our public health infrastructure is absolutely essential, I think growing those partnerships could be even more essential because there's a roadmap there to success. And so I just put that on your radar screen as you're looking to expand. One thing I'd like to ask, and Senator Blunt and I were in the Oval Office when the announcement was made with the president that we were going to lift the mask mandate, and I cannot tell you how joyful we all were as we ripped our masks off and had a great meeting after that. But there's confusion still, and if we're going to get more people vaccinated, which is the ultimate goal, all the way down through the age levels, we can't have this confusion because it just. Should I get my child vaccinated? How old can my child be to get vaccinated? Does my child need to wear a mask at school? Who's the ultimate decider here? Is that the CDC? Is it the president? Is the governor? Is it the NIH? I mean, there's just too much coming at young families in particular, I think, to be able to feel, number one, that their child is safe and they're doing the right thing for them to go to school, but also to get rid of that, I would say not anti-vaxxer, but vaccine hesitation. I think that's a large part of the people that are left as yet to be vaccinated. So how would you respond to that question?
Thank you. The guidance that we put out on Thursday was individual guidance for people who are fully vaccinated can take off their masks.
Right.
I was pleased actually the day before that the FDA had authorized and the CDC had recommended vaccination with Pfizer vaccine for individuals as young as 12 years old. That is now recommended. And my 16-year-old has been vaccinated, and we have a lot of community workers out there encouraging vaccination of youth. And in fact, over 600,000 people between the ages of 12 and 15 have been vaccinated just in this last week. In terms of guidance, the CDC provides science-based, evidence-based guidance to anybody who is the consumer of said guidance, whether it be industries, jurisdictions. Importantly, the country is not uniform. And so I think you really do need to interpret our guidance in the context of what is happening in your community. And that's really important in the context of a transmissible agent. Why is that important? Because the virus is going to be an opportunist. If you have a county that has low vaccination rates and high rates of disease, that county may interpret our guidance differently than a county that has high vaccination rates and low incidence of disease. So we really do have to do this at the local level because, in fact, the virus will, where there's less vaccination, the virus will emerge.
So what do you say to the under 12 population, elementary school, the parents of those children who have low vaccination rates, is probably close to nothing. They have low incident of infection, and all the studies that show the younger generation is not as affected as older and even more senior. What do you tell them? Listen to your governor, listen to your school board?
So what we would say is vaccines are coming for youth. We are hopeful to have, they're doing dose de-escalation studies now down to 9 years old, soon thereafter down to 6, soon thereafter down to 3, and then down to 6 months. So we are working towards getting a vaccine that will be available for all people.
So when would that?
Some of it depends on how much disease is out there in the community, so we can't exactly predict. But we're hoping to have more available in late fall and by the end of the year through these dose de-escalation studies. And then, of course, I think the guidance that we have had for schools has actually demonstrated that even in the absence of vaccinations, schools can be a very safe place, given the guidance that we have. We've recommended that schools not change anything for this school year because it will be hard for our youth to get fully vaccinated before the end of this school year. We'll be updating that soon, and then given that guidance, there'll be policies at the local and jurisdictional levels.
Well, I still think, I know you probably would agree that it is a bit confusing to folks all around the country who have children in school. I would just be as clear and concise and definitive when this science comes forward and more vaccinations come forward, because I think it really is, it's really difficult, I think, for parents to decide how to do the right thing. Thank you.